Hey, hi guys. Welcome to Back to Basics series. And today we have a very interesting topic called meta health. It's a topic which is not very widely known, though it's gaining popularity. If you do a Google search, you'll find a lot more concepts and lot more things written about meta health now. So we have with us Kavita Freedom. She's a meta health therapist and a master trainer. And believe me, we don't have many of these in India. So it's a great pleasure and great privilege to have you with us, Kavita. And she's going to talk to us about meta health. So before I give the mic to her, my understanding of what I got on the net, meta health is an assessment tool which goes beyond the physical symptoms and focuses on a set of factors like thought, emotion, triggers, lifestyles, interactions, and how these have an impact on our organs, on our physical organs, which then leads to illnesses. So let's start with the basic and ask Kavita, what is meta health?
Hi, Deepti, and thank you so much for this opportunity. And as you very correctly said, that meta health is now gaining that popularity, but we still have a long way to go in putting it forward to people as an option against medicine, surgeries, and whatever is the medical fraternity offering to us.
I think that till pharma industries and advertisement and media is there, it's going to take a long time.
I don't think it is going to take a long time if people just are willing to give themselves a little bit of a chance. I don't even say opportunity. I always tell people before you go in for that course of medication or surgery, just give yourself a chance by, doing a few therapies and see if it helps you, great. You know that it worked for you. Right. And most of the time, the ones who have taken the chance have not had to go in for the surgery or the medication.
I think that's something that people need to realize.
Yes. So that is where anybody who comes to me, I always tell them, just give yourself one chance. Like, let's just sit and see what is possible over here.
Right.
So now when I talk about meta health, meta means beyond. Okay. And health. So what we are looking here at is that we don't look at health just from its physiological point of view. We don't look at it just as the symptoms that are being shown to you. We look at what is beyond those symptoms.
Right.
Okay. And here it is a diagnostic tool, as you very correctly read it, an assessment tool which tells you that if this is the disease, what is the possible emotional trauma or conflict behind it? And it is not generic. It is very specific.
Specific to a disease or to a person or a combination?
To the disease and to the person. Because the perspective of the person when they are in that trauma also matters a lot.
Okay.
Now, in simple words, if I were to say, we have different brain layers. We have 5 brain layers. And each brain layer is given the task of dealing with a particular emotion. For example, brainstem is all about survival. What do we mean by survival? Everything and anything that I need to live, to survive. So I need food, I need water, I need my children, I need my home, whatever is your survival. So whenever that is going to get endangered, it is your brainstem which takes the hit.
Okay.
Now, whenever a conflict happens, along with the brain layer, your heart gets impacted because your emotions are involved in it. And that specific organ will get impacted, which is the best suited to deal with that conflict. So, for example, if it is an extreme disgust feeling, it is your pancreas which takes the hit. At that time, it won't go in your spinal cord.
Okay.
But if it is a conflict around feeling totally helpless, totally unsupported, it will go in your spinal cord. So it is so interesting that how every organ in your body has a specific emotion that it has been assigned to deal with.
Right. And this emotion can be for anybody. It could be towards yourself. It could be towards somebody else, towards a situation.
Yes. And whenever this kind of a trauma happens, we get impacted through our 5 senses. So what did I hear at that time? What did I feel at that time? What did I smell at that time? What did I see at that time? And what is it that I wanted to say, which I either said it or I didn't say it.
And it can be at any age.
Any age, right? Now, maybe if the two of us are having a conversation and you say something nasty to me, which I've not been able to take, it can be a very specific trauma for me.
Okay.
And what is the most beautiful part over here that we see is that physical diseases as well as psychological diseases, they also have a very specific trauma behind them. So today, when we are talking about depression, we are talking about anxiety, bipolarity, schizophrenia, they all also have very clear conflicts behind them. Now, not everything is a conflict. What do you mean by that? My maid who doesn't come every day on time is a big stress for me, but it is not a specific trauma or a conflict for me. It's happening every day.
Right.
But one fine day when she doesn't turn up and I come to know she's dead, it can become a trauma for me. So whenever we are looking from the meta health perspective, we need to keep 4 things in mind to find that specific trauma. It is unique to you. And it is something that is unusual. It has never happened before.
Right.
Okay. Second thing is the D, which we call drama. There is a lot of emotional charge over there. Third thing is you feel isolated in that. You feel totally alone. You don't know, it is like, I feel like the fish out of the water. And the last one is N, which is no strategy. I don't know how to deal with it. So when this Uden is there, that is when the diseases start. Because neither can you fight in that situation, neither can you run away from that situation. You freeze in that moment.
Right.
So I'll give you a very simple example. A newlywed girl. First night, she's there with her husband. And something happens and the husband gives a tight slap across her face. Is that a specific trauma?
Yes.
It is unusual, never happened before. Lot of drama, lot of energy over there, emotional energy. She feels lonely because she can't go and tell this to her parents. Her parents may not take it well. And she has no strategy to deal with this insult. So at that time, that is the onset of a disease.
And it is not necessary that the disease happens at the time of trauma.
Again, now there are 2 phases here. Actually, there are 5 phases to a disease, and all disease, no matter who it is, man, woman, child, we all go through that 5 stages of the diseases. Now, the first one is the stress, when the Uden happens. Okay, that is the time when you're constantly thinking, how do I get out of this problem? How do I get out of this problem? You're finding a solution. You're obsessed at that time. Finally, when you find the solution, you go off stress or the resolution phase. Now, that is when your aches and pains start in the body. Water fills up in that body, in that particular organ. And that's the time normally when you will go to the doctor because you're feeling so sick. You will not go at the time of the stress. You will go at the time of the off stress. Now, once you found the resolution, you worked on that strategy and all that, now all that excess water that got filled up at that time now needs to be pumped out because you don't need it. So then you go through the healing crisis, which is the body's way of throwing out all that was created in an excess. So that time vomiting, diarrhea, your periods is a healing crisis, and everything that is being flushed out of the body. It is the healing crisis. And then finally, you come back slowly, steadily into your normal phase.
And you can keep traveling between these phases.
Yes. So let's say you've gone to the doctor in your resolution phase. Okay. The doctor gives you the medicine. Now, basically, what does the medicine do?
It suppresses.
It puts you back in stress. And that's why many times you will see that that same problem reoccurs when the same trigger comes up again. So I'll give you another example over here. You're walking on the road. You're trying to cross. Dur se, you are seeing a red color Maruti driving very fast. For some reason, you stop, but there is another child and a mother that is crossing. The car comes and hits the child. There's an accident. The mother is flung away. She gets saved. The child dies on the spot. People gather around. There's a lot of chaos over there because the way the car screeched, that noise is there. You are there standing frozen. That is your Yudin. Now, how many triggers will you pick up in this incident? What did you see?
Red
A
car.
child being hit by the car. What is the other thing that you saw? The red color Maruti.
Yeah.
That road will get stuck in your head. The noise of that screeching car. The noise of all the people who gathered and they are talking, "Are zinda hai ki nahi, mar gaya, dekho, police ko bulao, ambulance bulao." All those are your triggers. Now you will go back home thinking, "Theek hai, whatever happened, happened." After 2 days, you will feel okay. But the next time you see a Maruti car, what happens? It's a trigger. Next time you are on that road, what happens? It's a trigger. Next time you see a mother and a child wanting to cross the road, it's a trigger. So in that frozen moment, as per your perception, whatever disease started in your body will keep getting re-triggered with all these things. So in therapy, when we take this particular incident, we have to clear everything. We have to clear the trigger of the red Maruti, the road, the mother and the child, the screeching, the things that were said. And once all that is cleared, you can go back on that road and nothing matters.
Right. So that's the therapy part of it, because typically in meta health, it's a diagnostic tool.
Yes, meta health is only diagnosis. Then you use whatever therapeutic method you know to clear that problem out.
So I know from experience that you take your, like, let's say when you're doing one-to-one sessions, your first session is a case study, which is based on meta health.
Yes.
Typically,
No,
what
it is not based on meta health. I have come up with my way of questioning the entire thing, because when I started learning, I realized the client comes for the first time and there is so much that they have, which they have not told us when we are just talking over the phone and giving an appointment.
Right.
Okay, like for example, somebody will tell you, "I want to come to you, because I've got pimples on my face." Okay, fine, you call the person and you want to do therapy, but then what has caused the pimples? When did it start? What was happening in your life at that time? All those details at that time then become very time consuming. So what I have started doing is that my first session is an in-depth case study where I talk about your physical issues, your emotional issues, your beliefs, patterns, how was your childhood, how was your adolescence. If it is a girl, I have to know her period cycles, because all this matters when you're doing your therapy.
Right.
So once you have all this information with you ready, it becomes easier to go through the therapy.
So the first session also helps you identify those triggers.
100%. All those triggers are getting identified, and also it is a kind of a bond of trust between the therapist and the client, where the client feels that, okay, I can talk about all these things, to this therapist, because of course there are so many times so deep-rooted things like a sexual abuse is there, for example, or there has been domestic violence in the family or in the marriage. Then all those things, they are not always comfortable talking with everybody.
Yeah.
And today, of course, there is a lot around even the sexuality part. They are not able to comfortably go and talk about, like, whether you are a gay or a lesbian and all that. So that bond of trust is very important between the therapist and the client, which gets established right in the first session. So then the other sessions go very smoothly.
So you mentioned that, you take them back to their childhood, to their adolescence. Now with many people, and this is a question which comes very often at Healclinic, is that what if I don't remember my childhood or specific events which the therapist is asking me to go back to?
So many times when somebody says, "I can't see anything," or "I can't remember anything," you first have to work on that block.
Okay.
Because the trauma can be so deep that you have given an instruction to the body, "I don't want to remember this."
Right.
So it is a file which is all ready, but it has been put into the locker. We need to open the lock and retrieve the file. Because everything that you have gone through, it is registered with your subconscious mind. You may not remember specifically at 5 years what happened, 10 years what happened. But when it comes to your disease, you know exactly what has happened. When it comes to your traumas, you know exactly what has happened. And the subconscious mind will support you when you are ready for it.
Okay.
And many times people tell me, what if I'm hallucinating? I said, fair enough. Even if you're hallucinating or making up a story, why are you particularly making up only this story? You could have said anything else. The very fact that you've given me this story, it's true for you.
Something similar to PLR, because a lot of people sometimes
Yes.
feel that I'm hallucinating or
yes,
dreaming in my PLR. But if that story has come, that character has come, then it has come.
Absolutely.
So
and the best part is, you know, you can even work on relationship issues. You can even work on money issues and all those things with the help of Meta. Why? Because the third level of Meta Health talks about something very interesting, and that is hormones and constellation.
Okay.
Okay. So when you understand that part, you understand why you have relationships the way you have. Because a lot of your personal relationships are being ruled by your hormones.
Right.
By your energy, whether you are at that time in your male energy or you are in your female energy. So if you can understand that, a lot of relationship issues also get resolved.
It's really interesting, because when you hear the title Meta Health, you typically assume that it's only for physical ailments.
No. It is definitely not just for physical ailments. Yes, maximum time it is, we are talking about diseases and the reasons behind that, but it does help you even with other issues.
I agree, because for me, the way I look at health is actually that how you live your life in every aspect. So it's not just your physical body, it's relationship, your career, your money, your physical body, your emotions. So if we expand the definition of health, then Meta Health covers everything.
Absolutely.
So one last question before we wrap up. So let's say you've done your case study, you have found the trigger points, you have found out what are the possible causes as to why these illnesses happen. Then how do you take it forward? Because Meta Health is
after that, let's say I have identified about 4 conflicts over there. So then in one therapy, I will deal with one conflict. You can't take all 4 of them together, because you want to clean it right from the root. Okay. So in the therapy, the way I work is I use a lot of inner child work. Okay. Because whatever has happened for you right now, you first need to clean it up in your this life.
Right.
Past life mein jo ho gaya, wo ho gaya. Right? But what is bothering you right now needs to be cleaned up first. So go back to that point when this whole thing started. Check what all was happening in your life at that time. Get that exact UDIN and the resolution, and you work accordingly. And it gets healed.
Right. So what are the chances that that same disease, once it's cleared, can it reoccur in a couple of years or couple of months if that trigger starts again?
If the trigger comes, then it can come back. Like for example, the way I give you the example of this newlywed girl, she is slapped. Okay. There is an onset of disease. Through therapy, we clear it out. She's absolutely fine. Whatever came up in her space is clear. Now she wants to. Exactly. So one very important factor in Meta Health is the environment. Because you're going back to that same environment. So there is some kind of empowerment that has to be given to this girl for her to be able to deal with this man. See, if it is one in a time incident that has happened, maybe some resolution can come up. But it is now becoming domestic violence. You're being beaten up every single day.
Because a lot of diseases in women come up due to relationships, whether it is parents, husband, in-laws, and they don't find themselves able to change that environment.
Why are we not being able to change the environment?
That's conditioning and societal pressure. That's a different topic.
Correct. So when all these things are there, because of which you're not going to be able to change the environment, healing the disease right from the root becomes very difficult until unless you can come to that stage of acceptance. that this is how it is. And now I have to find myself dealing with this in this way. But my question always is, how are you going to find acceptance with abuse and domestic violence? I can still find acceptance. Okay, my mother-in-law and my husband are inseparable. I'm a separate identity and I have to manage in that situation. Still possible. But if you're being beaten up every single day, I don't know how to teach anybody acceptance over there. Maybe my shortcoming, but I don't know how to do that. And there changing the environment becomes very important.
Well, that's a catch-22 situation, because somewhere, at least our generation and the next generation, we have not trained women to get out of situations, or creating support systems where they have the freedom to step out of these situations, heal, and then set themselves up again for a different life. So that's at a more at a societal level where I think we need to create those institutions and those processes and systems, because this needs a long-term support. It's not something that you can just get out of an abusive relationship and start a new life altogether. You need that.
I'll give you an example of a client which I had quite some time back, I think around 5-6 years now it is. When she had come to me, she had 32 tumors on the entire abdominal wall. Okay, with therapy work and everything, we cleaned out everything. For 4 years, her tests were coming clean of cancer. And now suddenly the cancer has come back again. And I know for sure that the environment did not change. And so the cancer has come back again. Because at that time also, she was struggling with wanting to change the environment. And the interesting part is this time she's not come back to me. Because she knows that I will tell her that it's your environment that you didn't change.
Right. Sometimes I think you also make a choice.
Well, if it is your karmic choice to not change that environment and be there, then at least do whatever you can to minimize your suffering.
Yeah. That's a good note to end. So thank you so much for this. And I think to all our listeners out there, if you're suffering from any kind of physical ailments, relationship issues,
any kind. I mean, don't think that, oh, this is like, what, see, many times we also say, ये तो होता ही है old age के साथ, diabetes तो आती ही है, high BP तो आता ही है, but who said you have to live with it?
No, I agree. Like just recently I got a call, like a cousin's husband got an heart issue, he's got a stent. So the person who was telling me said, नहीं but उसका तो genetic है क्योंकि उसकी family में सबको है. And I was really going to tell them that no, you know what, you have a choice. Somewhere we imbibe it in us कि genetic है तो ये होना ही है, not necessary. So guys, you have a choice. So all our listeners out there, I think what Kavita and me are trying to say is that you have a choice, exercise that choice. And like I tell to
whether
everybody,
it is genetic, whether it is in your family line, whether it is like because of age, or because I'm a girl, or because I'm a boy, no, you don't need to suffer. You don't need to live with the disease and medications for the rest of your life. At least give yourself one opportunity, one chance.
I think you owe it to yourself, and somewhere we've become used to living a suboptimal life or saying ki chalta hai, pop a pill and move on with the life. But you don't know that if that disease or that ache or pain goes away, what lies beyond that is something which we are not even willing to look at, because we have become so used to living with, यहाँ पे दर्द हो रहा है, थोड़ा सा ये हो रहा है, कोई बात नहीं. Had a medicine, like I would say something especially like diabetes, thyroid, BP, cholesterol is something which all of us have become
headaches, migraines,
and moving on with life. So if nothing else, guys, just come for a case study, because that will give you an awareness.
Yes, that itself opens up so much for you. So much of understanding comes that, oh, this is the reason why I have this disease. And that itself is your next stepping stone then.
Yes. So please do that. Make a choice. Empower yourself. So thank you so much for listening to us. And thank you, Kavita.
Thank you, Deepti. Thank you so much.